Welcome back to another episode of Preserve Health Talks. I'm Dr. Ira Perlstein with my co-host, Lee again, and this morning we're going to talk about the facts about statins for lipid management. There's been a lot of fear. There's been a lot of recent data, which is erroneous, on the internet, particularly Meta and other social media, about statins being bad and cholesterol being good. And we're here to take a deep dive into that this morning about the misunderstanding of some of these rumors. Because when you hear cholesterol isn't dangerous and statins are bad drugs with too many side effects on these online forums and social media sites, they thrive on fear and skepticism. And we're going to sort through that noise this morning, debunk the myths, and take a look at what 30 years of rigorous research has actually shown, because there have been no medications studied over the last 30 years more so than have been statin meds. There are scores and scores of statin studies, and we're going to talk about some of them this morning and why statins are good medications, but they're not necessarily for everyone. So we're going to start with some obvious questions, and Lee and I will discuss this.
So why do statins have such a bad reputation online?
Well, I think that social media thrives on drama, and fear sells. Nobody likes to hear good stuff. Drama sells. And it's easy to find anecdotes about muscle pain, brain fog, or big pharma conspiracies. But what these stories do is they ignore the actual evidence. They don't talk about the actual studies. And to be a really good study, it's not about an anecdotal study. This happened to my brother's cousin's sister's mother. You have to look at studies that are double-blinded, which means when they do these drug studies, they use the drug against placebo, and the researcher doesn't know what you're on, and the patient doesn't know what you're on, which makes a good double-blinded study. And we'll talk about some of those. And then add in influencers who are selling alternative supplements, and you've got the perfect storm between social media, fear sells, and supplement usage for misinformation. So another argument is that cholesterol is essential. So
Right.
therefore the higher the better, right? So why lower it?
That's partially true. Cholesterol is vital for hormones, brain function, and cell membranes. But the real problem is having too much LDL cholesterol. That's the bad cholesterol, which contributes to plaque buildup in arteries and increases the risk of heart attacks and strokes. So statins specifically target the harmful LDL while your body still keeps producing the good kind that it needs.
I agree. And LDL, which is the bad cholesterol, HDL, the good cholesterol. Let me explain what that means. What LDL and HDL do, think of them as carriers, sort of like the monorail at Disney World. They take people from Epcot to the Magic Kingdom and back and forth, and to all Disney things. So LDL carries cholesterol, and LDL would be the monorail that carries the cholesterol into the arteries. HDL would carry cholesterol away from the arteries back to the liver for processing. So what is a normal LDL? Well, if you have no risk factors, you can have an LDL as high as 160, and that's still considered normal. If you have a few risk factors, and as you age, your LDL can be as high as 100. If you've had some events, you want to get your LDL well below 100, 70. And the newer literature is pushing LDL down to as low as 40. So how low is too low? Well, we've looked at that. And the time where your body grows the most is when you're in utero, when you're a fetus. Fetal LDL is 27. The average fetal LDL is 27, and we know that to have a healthy term baby, you can get your LDL way down. Fetal LDL is 27. You could get your LDL well below 40, eliminate a lot of cardiovascular risk. So, is cholesterol good? Yes, you need a certain amount of cholesterol. But when the body makes too much cholesterol, particularly the LDL carrier of cholesterol, we need to lower that. And we need to lower that with medications. And statin medications are the best medications first line to lower cholesterol.
They also reduce inflammation in the artery walls and just decrease that risk of heart attack, strokes, and cardiovascular death.
I agree. So let's take a look at some of the big studies of cholesterol and why I think we need to discuss those. Because landmark studies, double-blind studies, tell us that these medications work and they're effective. In 1994, we came out with a trial called the 4S trial, and it was done with simvastatin. It was the original game changer, and it showed that simvastatin reduced deaths in people with existing heart disease. It was a landmark study. The heart protection study, which came out almost a decade later in 2002, and these are large studies. That study had over 20,000 participants, and that study showed that statins significantly reduced major cardiovascular events. What are major cardiovascular events? Heart attacks and strokes, even in people with normal cholesterol. So if I took someone with a normal LDL cholesterol and I lowered it further, it still reduced events.
Exactly. Another big study is the HOPE-3 study, actually, in 2016. Statins help people at moderate risk, not just those with existing disease. What are some other studies?
Well, the Improve It study, which came out in 2015, it showed that combining a statin with another LDL lowering drug, the brand name Zetia, which is ezetimibe, I like to call it ezetimibe because
Yes.
that's how it's spelled. It even added more benefits. So statins with the addition of another medication worked even better. And then there was the Jupiter trial in 2008. And it was done with Crestor, which is rosuvastatin. It lowered heart risk in people with high inflammation but normal cholesterol, and showed us that statin meds not only lower LDL cholesterol, but are great anti-inflammatories. And why are they important as anti-inflammatories? Because inflammation in the arteries leads to plaque rupture. And people don't die from hard plaque. They don't have heart attacks from hard plaque. It's like my calcium is only 40% and it's 70%, and now it's high, I'm going to have a heart attack. We're talking about people who are out in the winter shoveling snow, or the jogger, or someone who goes to the gym and lifts a lot of weight, and they have this soft rupturable plaque and it ruptures and it goes downstream. So if I lower LDL cholesterol and I decrease vascular inflammation, I treat soft rupturable plaque, and that's always a good thing.
So let's talk about side effects. That's usually a big concern with patients, are side effects. So why don't you tell us about some of those?
Well, I think most people say I can't take statins or I don't tolerate statins because of muscle aches. But if you start low and go slow, and then add in supplements such as coenzyme Q10, which does help relieve some of the muscle aches, and stay well hydrated, you'll find that fewer than 10% of patients have true statin intolerance. And many of these symptoms are driven by a placebo effect. So if you expect to have muscle cramps, sometimes you're going to have muscle cramps.
Exactly. And importantly, serious complications like liver damage or diabetes are rare, and the benefits far outweigh the risks in most patients.
Oh, I agree. So let's talk about diabetes and statins. Statins do not, equivocally, they do not, I mean unequivocally, they do not cause diabetes. What statins can do is they can raise fasting glucose by about 10%. But even diabetics, they don't die from high blood glucoses. What they do is when they have an event, and what causes deaths in most diabetics are due to high LDL cholesterol and high triglycerides. And statins are the number one way to lower LDL cholesterol. And we check for liver damage, we check for
Yes.
muscle damage. How high do we allow liver function to go on statin meds? It's acceptable to have a little bit of abnormalities of liver function on statin meds, but most patients will tolerate them without any liver abnormalities. But up to 3 times the upper limit of normal is still acceptable to continue the use of a statin meds.
Right. And I think we actually have probably a whole nother show talking about patients who are truly intolerant to statins. They just cannot tolerate taking them. We could just talk on and on about there's injectables and a million other ways to help lower cholesterol.
Right, there are injectable medications. There's several medications that work on different pathways than statins do. So here's the bottom line. Let's talk about it. Statins are among the most studied drugs in medicine. They've been around for over 30 years. They save lives. And for people at risk for cardiovascular disease, they're often the single most effective medication that we can offer.
Go ahead. Don't let fear or some viral posts that you see on social media guide your decisions. Talk to your doctor, ask questions, and trust the data. Don't make decisions based off one social media post and stop your statin or go to Dr. Google. Make sure you speak with your doctor.
I agree. So that's it for today's episode. Statins, they're important, and if your doctor wants to use them, give them a try. That's it for today's episode of Preserve Health Talks. We look forward to seeing you again very soon.